Hello, everyone. My name is Dr. Shelley Wang. I'm a pediatric neurosurgeon at Nicholas Children's Hospital and faculty at the University of Miami. Thank you for allowing me the opportunity to speak today about the initial experience with focused ultrasound surgery for central brain lesions in children and young adults. I have no disclosures. Transcranial magnetic resonance guided focused ultrasound has been FDA approved for the treatment of tremor in adults. However, its role in the pediatric population remains unclear. In 2017, in order to address this issue, a proof of concept trial was started at our institution to determine the safety and feasibility of transcranial focused ultrasound on this population. The goal of this ongoing pilot trial is to determine the safety and feasibility profile of Exablate 4000 MR-guided focused ultrasound for the treatment of benign intracranial tumors which require clinical intervention. Inclusion criteria was ages 8 to 22 years with a minimum head circumference of 52 centimeters. The patient must have a pathology consistent with WHO grade 1 tumor, and of note, previous craniotomy and treatment was not an exclusion criteria. Our primary outcomes measures were incidence of treatment-related adverse events and the measurement of lesion volume on follow-up MRI. This was a non-blinded, single-arm, single-center study at Nicholas Children's Hospital in Miami, Florida. We had a goal of 10 participants. So far, we have recruited 5 patients who underwent focused ultrasound treatment between March 2017 and October 2019. For the procedure, the patient is induced under general anesthesia and intubated. 20 milligrams of intravenous dexamethasone is administered, and the scalp is razor-shaped, followed by application of the CRW frame. The patient is then transported to the MR scanner, and the head frame is secured to the phase array device. Cooled degassed water acoustically coupled with a transducer array is applied to the patient's scalp. A series of low-energy sonications using less than 200 watts is performed to raise the tissue to 40 to 45 degrees Celsius and used to detect and, if necessary, correct the alignment of the sonication centroid. Once the target and low energy co-alignment are completed, high energy sonications with acoustic power up to 1500 watts are undertaken to create a series of overlapping thermoblations to cover the region of interest. Goal peak temperature at the target is 56 to 60 degrees Celsius, which is a range known to create nearly instantaneous tissue coagulation necrosis, but reduce the occurrence of inertial cavitation. After the procedure, the CRW frame is removed, the patient is extubated and transferred to the pediatric ICU, where he or she will be observed for 1 to 2 days before discharge home. Metabolic and endocrine labs are monitored postoperatively, and the patient is discharged with a 5-day taper of steroids. So far, we have recruited 5 patients between the ages of 15 to 22 years. 3 of them are females and 2 are males. Geographically, 3 patients are from Florida, 1 recruited from California, and 1 patient was an international patient from the United Kingdom. 4 patients had hypothalamic hamartoma, and 1 patient had SAGA associated with tubular sclerosis complex. This is the breakdown of our 5 patients. As you can see here, they range between 15 and 22 years of age, and 4 of the 5 patients had hypothalamic hamartoma. 3 of the 5 patients had previous surgeries or interventions. After the procedure, none of the patients developed any kind of biochemical, metabolic, endocrine, or neurologic abnormalities. They all tolerated the procedure very well and was discharged home by postoperative day 2. And as you can see, they have been followed for a period of 12 to 30 months. The patients with hypothalamic hamartoma experienced the best outcomes with either a greater than 90% seizure reduction or a sustained and complete resolution of hyperphagia. As an illustrative example, this is a 15-year-old girl with hypothalamic hamartoma, precocious puberty, and hyperphagia. She has had no prior surgery or treatment, and her MRI shows a large bulbous hypothalamic hamartoma on a thin pedunculated stalk, which is the area of our target, in order to disconnect the large lesion. Preoperatively, this is her coronal T2 MRI. Intraoperatively, there is a definitive area of T2 signal change correlating to the area of thermoablation. Interestingly, at 3 months after the procedure, this T2 signal change, which is also reflected on FLAIR, has mostly disappeared. However, her clinical improvement remained. Postoperatively, like all of our other patients, she had no adverse events. She had almost a complete cessation of her appetite and a loss of 13 kilograms over a couple of months after surgery. She returned to the UK and she was followed by Gosh. Her incredible story can be found at the Hope for HH website. This is a picture of her weight loss and a picture of her with our principal investigator, Dr. John Ragib. In summary, we have treated 5 patients so far, and focused ultrasound seems to be very well tolerated in this population with no unexpected radiographic abnormalities or clinical abnormalities. The patients with HH did particularly well from this procedure, and on follow-up MR imaging, the lesions were less perceptible compared to intraoperative imaging. However, the benefits of focused ultrasound persisted despite regression of the MR findings over time. The preliminary data from our trial is very promising, and this is an ongoing trial, and we are currently still recruiting patients aged 12 to 15 years with central brain tumors. So if you know of anybody who would fit this criteria and would be interested in making a trip to Miami, we would be more than happy to collaborate. So I'd like to acknowledge the ongoing collaboration and teamwork of all of our team members from the Department of Neurosurgery, Neuroradiology, Neurology, and Neurosciences, including our principal investigator, Dr. John Ragib, and also I'd like to acknowledge the funding support of the Focused Ultrasound Foundation grant. Thank you so much for your time.